Here are a few case studies that illustrate the application of pharmacogenomics in cardiovascular medicine. 1. Warfarin and VK-ORC1 CYP2C9 genotyping. Warfarin is an anticoagulant commonly used to prevent blood clots in cardiovascular conditions. However, its optimal dosage can vary greatly among individuals due to genetic factors. Genotyping of the VK-ORC1 and CYP2C9 genes can provide valuable information about an individual's response to warfarin. For example, a study published in Circulation in 2009 examined the impact of genotype-guided warfarin dosing on clinical outcomes. The study found that patients who received genetically guided dosing had a significantly reduced risk of bleeding and thromboembolic events compared to those receiving standard dosing. 2. Clopidogrel and CYP2C19 genotyping. Clopidogrel is an antiplatelet medication used in the treatment of cardiovascular diseases such as acute coronary syndromes and after stent placement. However, some individuals have genetic variations in the CYP2C19 gene that affect clopidogrel's activation. Genotyping for CYP2C19 can help identify poor metabolizers who may have reduced drug efficacy and an increased risk of cardiovascular events. A study published in the New England Journal of Medicine in 2010 demonstrated that CYP2C19 genotyping could identify patients at higher risk for adverse cardiovascular outcomes, leading to a potential modification of treatment strategies such as alternative antiplatelet therapies. 3. Beta blockers and ADRB1 genotyping. Beta blockers are commonly used in the management of hypertension and heart failure. The ADRB1 gene encodes the V1 adrenergic receptor, which is the target for beta blockers. Genetic variations in ADRB1 can influence an individual's response to beta blocker therapy. A study published in the Journal of the American College of Cardiology in 2013 investigated the impact of ADRB1 genotype on outcomes in heart failure patients receiving beta blockers. The study found that certain ADRB1 genotypes were associated with a greater reduction in heart failure-related hospitalizations and mortality when patients were treated with beta blockers. These case studies highlight how pharmacogenomic testing can provide valuable insights into individual drug responses and guide personalized treatment decisions in cardiovascular medicine. By considering genetic variations that impact drug metabolism, efficacy, and adverse events, clinicians can optimize medication selection, dosing, and treatment strategies to improve patient outcomes. However, it's important to note that these case studies represent specific scenarios, and pharmacogenomic testing recommendations may vary based on factors such as clinical guidelines, patient characteristics, and availability of testing resources.